Hello. Today I'd like to talk about zinc, and in particular I want to talk about a study which I'll talk about in a few minutes. But first of all, I want to say if you're looking for medical advice, you won't find it here, and you can always get that from a certified licensed medical professional physician. My purpose here is to go through a paper that I have not seen quoted online, but I have seen many people who should know better state that there's been no research that would indicate that zinc has clinical efficacy in treating coronaviruses. And as you probably know by now, we have a pandemic globally by a particular coronavirus that's very similar to the coronavirus for the common cold, but this one is a new one that's called SARS-CoV-2. That's the name of the virus. The name of the condition caused by that virus is COVID-19, that you've probably heard many times by now. So this paper is by the Royal Society of Medicine. It's called Zinc Lozenges and the Common Cold, a meta-analysis comparing zinc acetate and zinc gluconate and the role of zinc dosage. So meta-analysis means it looks at 7 trials and using zinc in a clinical situation, which is known as in vivo studies, as opposed to in vitro studies where you take human cells and put them in a test tube and do tests on the cells alone. So this is a study where they have 7 placebo-controlled, double-blind studies, and they have that demonstrate efficacy. And this paper summarizes them all. It's 7 pages long, so and it's very dense, and so I'm going to summarize it, the basic results. I'll just say that they found that zinc acetate and zinc gluconate worked reasonably similarly, and I'm going to focus on the zinc acetate group because that one has the tightest interval, confidence interval, and so we can be more sure that that one is likely to work. So I'm looking here. One of the factors that I experienced earlier on in this was I was following zinc because I'm interested in such things, and I was convinced that zinc did not work because there were many studies that showed that zinc did not shorten the duration of the common cold. But I found out in this study that the zinc lozenges contain substances that tightly bind zinc, and I can list those off. There's sorbitol and mannitol, which are sugars that are put in because zinc doesn't taste too good. They want to make the medicine go down better. But these bind to zinc, and when people suck on the lozenges, the zinc doesn't enter their saliva, so they get no zinc, and under those conditions there's no clinical improvement. So so I talked about sorbitol and mannitol. There's also sodium bicarbonate, which is a common ingredient, and citric acid, so you get zinc citrate, which also binds it and prevents it from working. So I'm going to just jump to the, see now, yeah, what I'm looking for is the zinc acetate results. There we go. Okay. Yeah. The estimate of zinc acetate indicates a 40% reduction in the duration of the common cold. That means a 40% reduction in the time it takes to get over a coronavirus of the common cold variety. And this has a 90% confidence interval that's quite tight. It's the lowest that would be possible in this scenario is 31% reduction in duration. And the highest that would fit in at the 95% level of certainty is a 50% reduction. And the mean reduction was 40%. So that's a very clinically significant result. And such an effect seems to be reached with doses of 80 to 92 milligrams per day of zinc. Now this is a little higher than, again, I'm not a medical doctor, but just from reading articles on that, a little higher than than I'd be comfortable with for a long period of time. Like the daily dose of something between 10 and 20 milligrams would be more safe. And zinc is something that if you took it for a long period of time at high dosages, it actually suppresses your immune system. So, but for what they found effective, they found it was effective at about 80 milligrams, and that's a very safe dose for like the maybe 5 to 15 day periods, or even 30 that you would have dealing with, for example, the SARS-CoV-2 type virus. So sometimes people would talk about, we need a double-blind placebo-controlled trial for the new SARS-CoV-2 type of virus in order to be able to evaluate the clinical efficacy of zinc as a treatment. But really, we've only had this new SARS-CoV-2 virus causing problems for about 3 months, at least in North America that is the case. So it would be quite naive, if not a slightly disingenuous, to expect anyone to have such a gold-plated trial performed for zinc in this time frame of 3 months. So why I'm bringing up the coronavirus studies? One is because they're very good. It's a very good study, and it proves efficacy for the coronavirus of the common cold. And I take that as a very strong signal that we should test it on the new SARS-CoV-2 virus in a clinical situation. So there's a very strong signal. It has proven efficacy for that family of viruses, and I think it's important that we test this zinc with the SARS-CoV-2 virus, and we might even test it with other chemicals such as chloroquine, which is known as a zinc ionophore. In other words, it opens up the pores so that the zinc can get into the human cells. And we have in vitro studies that show that once inside the cell, human cells, the zinc really does profoundly inhibit the viral replication, and so it could actually potentially shorten the treatment time and perhaps save some lives. So I think it's important to consider zinc as a potent ally in treating this disease. So let me see, anything else I want to say? Yeah, I just want to say these trials, 7 randomized trials carried out over 3 decades by 6 different research groups, and it's performed by the Royal Society. And I'll say the title again so that you can write it down, perhaps. Zinc lozenges and the common cold. A meta-analysis comparing zinc acetate and zinc gluconate and the role of zinc dosage. Thank you very much.